Welcome to my channel, Brainies. In today's video, I'm going to talk about the Tug test, which is the timed up and go test. The timed up and go test is a very simple assessment which is used to assess the person's mobility, the balance, and the fall risk. It involves the timing which has been taken by the person to stand up from the chair, walk for 3 meters, turn 180 degrees, walk back to the chair, and sit down. Longer the timing, greater is the risk of falling. The test assesses the following: the balance, which includes both the static and the dynamic balance; the gait speed, which measures how quickly a person can walk; the functional mobility, that is, ability to perform the common aerial activities of daily living. The next is the neuromuscular components, which incorporates the strength, agility, and the power. The procedure: the materials required are such: a stopwatch, armless chair, 3 meter distance which has been marked on the floor. The procedure is: ask the person to sit in the chair. They can wear the normal footwear. If they are using the walking aid, they can use it. Give them the trial first before you could start the actual procedure. So when you're starting the procedure, ask the patient to stand up on the word go. Ask them to walk at their regular pace to a 3 meter line. Turn around and walk back to the chair to sit down. The timer starts when they begin to stand and stops the moment when they are properly seated. So safety is required. There are chances for the patient to fall, so it is better to assess the patient. This is a picture depicting the Tug test. An interpretation of the results: if the time taken by the patient or the person is 10 seconds or less, it indicates the normal mobility, that is freely mobile, and there's a low risk of falling. If it's going to be 11 to 12 seconds, it's typical for a healthy older adult. And if it is going to be 13 to 14 seconds, it's borderline. It may indicate mild mobility impairment. And if the time taken is more than 13.5 seconds, it indicates increased risk of falling. And if it is more than 20 seconds, it denotes limited functional mobility. And if the time taken exceeds 30 seconds, then it requires assistance and there's a high risk of falling. This is the scoring sheet of the Tug test, which is used to fill it up. That's it with my video. Thank you for watching. Kindly support by subscribing and sharing. Meet you all in next video. Thank you once again.